Right everybody, it's Friday night and we're answering your questions again. Thanks so much for writing in. There were hundreds of questions about the knee joint. That's the stifle joint. It's here in a dog, it's here in a cat, and most of your questions were about the knees of dogs and specifically about two conditions, cruciate ligament disease and luxating patellas, which are slipping kneecaps. So we're mainly going to deal with that. You've said hundreds of questions. I could spend hours talking about the knee because it constitutes a huge volume of the cases that I see and my colleagues see here at Fitzpatrick Referrals on a weekly basis. But let's get started and see how we do. Here we go. All right, my friends, let me introduce you to the knee joint. And that's the joint between the femur here, which is the thigh bone, and the tibia here, which is the shin bone. The patella or kneecap is up here running in a groove. The knee is a hinge joint. That's extension, that's flexion, but there's also some torsion, like so. And there's 5 major ligaments that hold everything together. There's the cruciate ligaments, so called because they cross over inside the joint. One runs forwards, one runs backwards. The one that runs forward is called the cranial cruciate ligament or the anterior cruciate ligament. The one that runs backwards is called the posterior or caudal cruciate ligament. You can see the cranial one in there running forwards, and the caudal one here running backwards. There's also ligaments on the side of the knee. This is the medial collateral ligament and this is the lateral collateral ligament. And then there's this big ligament or tendon here, the straight patellar tendon, which holds the kneecap onto the tibia and transfers the load from the quadriceps muscle up here. Now, when we talk about cruciate ligament disease, we tend to be talking about the one that runs forward. That's the anterior or the cranial cruciate. It runs forward like that. That's the posterior one, that's the anterior one. And what that ligament does is it inserts on the tibia here and inside the femur here. And when it's ruptured, the femur slips backwards. And we can use the analogy of a truck parked on a hill. So the femur is here, parked on a hill, which is the top of the tibia, the so-called tibial plateau. And if the anterior or cranial cruciate ligament is ruptured, the femur slips down that slope. And when that happens, when the femur slips down the slope of the tibia, as you can see, it's going to damage these cartilages here, which are called the menisci. There's 2 of them, one on the inside, which is medial, and one on the outside, which is lateral. And when the femur slips down that slope, it can damage these menisci, particularly the one on the inside, the medial one. And eventually over time, if it rubs and rubs and rubs, you can get a really torn up meniscus and you can lose cartilage here between the femur and the tibia. So when we talk about cruciate disease, remember that we're talking about one of the ligaments inside the knee. And today, what we're going to talk about is damage to that cranial cruciate ligament. And we're also going to talk about the patella slipping out of the patellar groove, which is called patellar luxation. So let's begin. Alrighty, well, it's hardly surprising that most of your questions were about rupture of the cruciate ligament. Now remember what I said. It's generally the anterior or cranial cruciate ligament that ruptures. And when that ruptures, the femur is like a truck on a hill, slips down the hill, may damage these cartilages here. So it is very important what you decide to do. There's a lot of questions here about surgical intervention versus non-surgical intervention and what kind of surgical intervention that you should or should not use. And in my mind, there's 4 factors: ethics, evidence, efficacy, and education. And I think it's important for you to educate yourself about the evidence and the efficacy of techniques. So Anne MacDonald here asked on Twitter about her 8-year-old Labrador. A TPLO has been recommended. How effective is that and what is recovery like? So let's talk about TPLO. TPLO stands for tibial plateau leveling osteotomy. It's where the tibia is cut with a curve and the top of the tibia is rotated around so that the femur doesn't slip down anymore. And that operation is very common, as is this one here, which is called a TTA, tibial tuberosity advancement. And in a tibial tuberosity advancement, the front of the tibia is chopped off and the straight patellar tendon is moved forward, which takes up some of the strain. Now, I don't have time right now to go into the biomechanics of these, but one thing that I would like to share with you is that there's been a lot of scientific evidence published on both of these techniques, and as a result of that and our own experiences, we used to do some of these and some of these, but now we do all these. More or less 100% of the dogs that we treat at Fitzpatrick referrals are operated with tibial plateau leveling osteotomy for cranial cruciate ligament rupture. And the reason for that is evidence. So this is a paper that I published in 2010 about 1,000 dogs that I operated on between 2004 and 2009. The overall complication rate was 14.8% and the major complication rate was 6.6%, of which all of those were treatable in this case series. Now, that's a relatively low complication rate. We've done about 7,000 TPLOs here over the last decade. And it's important, I think, that you ask a surgeon, how many of these have you done? How long have you been doing them? What's your results? What is the efficacy? And how long will it take my dog to recover? In fact, that's the question that Anne MacDonald posed. And when you look at this, I think that the dog should return to more or less full function between 6 and 8 weeks, and 95% of dogs should be in that category. And that's what we're achieving with TPLO in this practice. The other thing that I think is worth considering is that specialists train for a long time. I wasn't a specialist in the earlier part of my career, and then you do a lot of exams and you do a lot of operations and you become a specialist. And they're like a human consultant. So I think it's worth asking the question, what is the level of training? How many of these have you done? And are you specialist or not specialist in this particular area? Not an egotistical thing to say at all. Of course, your primary care clinician will help you make the right decision for you. But it's your dog, it's your money, it's your choice. And I think that you need to ask those questions, like what Franz Bastian is asking here on Facebook about his rescue dog who torn their cruciate and wonders what options there are other than surgery. Well, there are options other than surgery, but remember, if that femur's slipping up and down the tibia all the time and it's really unstable, it's unlikely you're going to get away with just physio. But cranial cruciate ligament disease is a spectrum of disease. That ligament rarely ruptures as a result of trauma. It generally ruptures as a result of genetic predisposition. So you can have a partial tear which progresses over time to a complete tear. There's this whole spectrum of disease resulting in rubbing and moving abnormally and creating inflammation in the joint, which is osteoarthritis. So sometimes you can deal with this with physiotherapy and laser therapy and hydrotherapy and braces and the help of a rehabilitation practitioner, but other times you really do need surgery. And the bottom line is that you ought to consider how long is it going to take your dog to recover, how long is your dog uncomfortable for, and what is the price you're paying for all of that time. The other thing to remember is that often this disease is bilateral, so it often affects both knees, and often there's a genetic predisposition. In fact, there's a question here from Tilly on Instagram asking what she can do to prevent her 6-month-old boxer from rupturing the cruciate ligaments like her last boxer did. Well, obviously keep the body weight down, obviously keep the doggy fit, hydrotherapy and so on, but here's the thing. Boxers have a recognized genetic predisposition to rupture the cranial cruciate ligament, and that's in the literature, that's not my opinion. So often it's bilateral, it's on both legs, and often there's a genetic predisposition to this condition, maybe associated with how the dog stands or inflammation within the knee. But the bottom line, I think, at the end of the day, is that you need to think about what's in your dog's best interest. You ought to do price comparisons, you ought to do success rate comparisons, and for me, the last thing I wanted to say is about aftercare. I think it's critical that we do the right thing. Ethics. What is the ethics around operating on cranial cruciate ligament rupture? And I think that means what is the pain control, what is the decision-making process, what is the transparency about the number of those you've done, your training and the cost. We use a lot of epidural anesthetic which goes in here and we find it amazing in association with the general anesthetic to control the pain around the time of the operation. And I think that all of these dogs need overnight nursing for 1 or 2 nights after the surgery, or as long as is needed until they're comfortable to go home. And I think that's our moral responsibility. So when you look at cost, I think you need to look at the whole package. What is the workup? What is the operation? What is the post-operative x-ray pictures? What is the longer term in terms of rehab and aftercare? And just to come back full circle, cranial cruciate ligament pathology is a spectrum of disease. And it's up to you to decide where on that spectrum you want to go. And I want to reiterate the 4 E's. You need to look at the evidence for each technique. We've done that, and we've decided in our practice TPLO is more effective with a lower complication rate. You need to look at the efficacy. What is happening with those dogs over time? And we've got a lot of force plate data, a lot of data that following up a decade later. These dogs, although they get osteoarthritis, many are fully functional for the rest of their lives. You got to educate yourself, that's critically important, and then you got to look at the ethics of it. Are we doing the right thing? Just because it's possible to do something doesn't make it the right thing to do. And my role in chatting to you with these little videos is to try and help you to make the right decision for your dog that you love, and I hope this has helped.